All right, welcome into All Things Odd. I am Dr. Natalie Phillips.
And I'm Dr. Hannah Galloway.
All right, and we are going to get started here. But before we get started, as people are kind of rolling in here, I'm going to start to show this and have Dr. Galloway take a look at this.
Yes, so this is our YouTube. So you can go on here and subscribe. If you don't have Facebook, or if they just kind of organize them in a different way here, so they're a little bit easier to see the different episodes. We have 7 subscribers, so we have gotten 1 new subscriber since last week, which is very exciting.
Yeah, and so if you miss our shows, go ahead and head over to the YouTube channel, and you can easily catch them a lot easier because they're all organized in different playlists as well, than trying to find it on our Facebook, which is also another way you can watch it, but you can share it from YouTube as well. So if there's an episode that you like, you can share it from YouTube directly from there, and people don't have to scroll all the way through YouTube. So yeah, we will finish posting that. Okay, so I'm still kind of posting it into some of our groups here, but we have kind of a fun topic because we were driving to work today, and I was sharing a car with my husband because we were down one car, as one is in the shop right now. And, we were talking about why is it that when you are driving somewhere and like you get lost, that you turn your radio down and in order to like start looking for where you have to go, right? So I think that's kind of funny. Or it really came up to where I remember when I was taking American Sign Language class, and we were super like intently watching our teacher sign to us, right? So again, we're all hearing, she's hearing, and she's teaching us different signs, and we're like leaning in and really like focusing on where our hand placement is and the movement of her hand and everything. And all of a sudden another class, I think, got out, and so there were all these people walking by the open door, and oh my gosh, it was so distracting. Like we literally had to get up and close the door in order to focus on what she was saying. And then she stopped and she started laughing because she's like, "What are you guys doing? You guys are all hearing and you're not even using your ears to learn, right?" And so I thought it was kind of funny, but it brought up this topic of auditory processing disorders, or basically saying like, okay, but I can hear, but how come sometimes I can't hear? Or so, why is it where some things are distracting? And so we wanted to kind of talk a little bit more about this, and we came up with some different things that we can kind of discuss with you. And if you've got any questions at all, hopefully we can answer it. Or again, we will call upon our audiologists that are joining in, and maybe they can add in what we're talking about, or maybe some answers as well. Okay, so first of all, we're going to talk about I've talked about where and what types of environments that I may experience, like where I'm a little distracted, right? I know that Dr. Galloway has also got an environment that I think, more often we hear this with people, right? So, yeah.
Yeah. So, and we've heard a lot of this emergence of this hidden hearing loss. And that's not necessarily like a diagnosis of APD, but what will happen is, well, especially younger people will come in, their hearing is completely normal by a hearing test, and they'll say, whenever I'm in a crowded environment or a restaurant, or, there's a lot of things going on, like I hear what people said, but I have trouble like interpreting it or understanding what they said. And so they think that maybe they have some hearing loss. So they come in and we check it and they don't have hearing loss. But there's a difference between the act of hearing and detecting sound versus actually processing it, understanding it, getting those higher level sort of brain processing features. So we a lot of times we'll hear people come in and say, well, I struggle especially in background noise, or especially when there's a lot of other things going on. So any person can have more difficulty in a more difficult environment. What we call auditory processing disorder is actually something that we can diagnose based on a battery of tests where the person's ability is less than what we would expect based on peers that are the same age as them. And so everybody has a different, level of auditory processing ability. So just because you have trouble in noise doesn't mean that you have APD, or auditory processing disorder, but everybody sort of has a different ability. Some people really, really struggle in noise amongst normal hearing thresholds, and other people tend to do okay. So there's an attention piece, definitely, talking about, when you turn down the radio so you can see better, because it's like you're just completely overstimulated, and like getting rid of some of that auditory stimulation sort of helps you focus on the visual aspect, I guess.
Yeah, I think it's hilarious. And so we put up this diagram here, and it's Erber's model of basically how sound is going through the hearing system all the way up to the brain, right? And so it starts with awareness, or that detection level, right? Is there a sound there, or is there not a sound there? Then it goes to discrimination, where your brain starts to say, okay, is it something where the difference between, we were talking about it earlier, BET, and BAT, right? And so that discrimination, we do discrimination testing in a regular hearing test too. And sometimes with a high frequency, we can see the differences in those softer
Mhm.
consonants that are at the beginnings or endings of words like cat versus cap. Then it goes to the identification, where you start to assign some different meanings to the words or these sounds that are together, right? So that it makes sense to you. Oh, that's a word now, because these sounds put
Mhm.
together, these phonemes put together now make this word, right? And then it goes up to comprehension, where you're taking this word and maybe making sense out of it as part of like a sentence or something. And so Dr. Galloway and I were talking right before the show, and we were talking about her daughter Ruby, and how she said, "Hey, go get the hairbrush," at a totally random time, not necessarily after the shower. And she is about, let's see, so it's June, 15 months old ish.
She's 16 months. Yep.
16 months old. Okay. So, so it's interesting to watch how she went and got a hairbrush. And Dr. Galloway
Mhm.
was saying, she could have brought in a toothbrush or a hairbrush, because she probably knows the word brush, but she got the right thing. And so it's interesting,
Mhm.
to watch the process of this developing, as young as even 16 months old, right?
Yep.
And so this is kind of a really cool model of how the sound is going through that brain, and how it gets all the way up to comprehension. And remember this, because as we start talking about it, APD really is when the brain has a hard time either processing, remembering, or even understanding words that have been spoken. And so there's a
Mhm.
breakdown sometimes. We're going to talk a little bit more about, how do people develop this APD, right? Or get APD, because APD is auditory processing disorders. And if you've seen APD or CAPD, just to let you know, APD is auditory processing disorders. The C just means central auditory processing disorders. And back in the day, we used to use CAPD a lot, because it helped us differentiate when we were talking among colleagues, that it's a central loss, right, within the brain, versus peripheral, which is what we normally test for in a regular hearing test. And so this is the reason why, if a person comes in and, let's say, okay, I'm just going to pick on my husband right now. Let's say, like, I've been talking to him in a restaurant and he has no clue what I'm talking about, but when we're talking at home, he can follow along, right? And I would accuse him of saying, "I seriously think you've got auditory processing disorders, because you can't hear me in a restaurant setting," right? And so let's say he comes in, and this has happened. So this is a true story. And I put him in the booth, and I'm like, "Okay, seriously, you have a hearing loss." And I put him in the booth, and guess what? His hearing test, his basic hearing test, looks totally normal, like normal 150 to 8,000 hertz, which is what we test, right? Me as the audiologist, I'm frustrated, because I'm like, seriously, come on, because he cannot hear me, right? But I would almost bet that if I were to do an auditory processing evaluation on him, maybe I would pick out some different areas, based on the evaluation. And we'll talk about the evaluation process as well. So, again, I'm going to take down this hierarchy type of thing. And I want to put actually a video that we found up here. Because I think that this video kind of shares a little bit more about how it works. And I think it's kind of cool. And so last time we had a video, it didn't quite work. So hopefully this works with the sound. And Dr. Galloway, hopefully you can let me know if you hear this or not. Okay, so we're going to share that. And I'm going to make sure that, okay, so let's try this.
Central Auditory Processing Disorder, or CAPD, is a neurological deficit that affects how the brain processes spoken language and is estimated to affect about 5% of the human population. This condition makes it difficult for affected adults and children to understand verbal statements or filter out background noise when listening to somebody talk. Indeed, such individuals may complain of being able to hear fine, but have trouble understanding. CAPD, also known as Auditory Processing Disorder, or APD, results from deficits in the brain pathways responsible for processing sound. There is no hearing loss or any problems with the ear itself. In a normal individual, if the statement, "the boy jumps the fence," is verbalized, the auditory cortex of the brain correctly processes the sound and the person comprehends the statement, "the boy jumps the fence." However, with CAPD, something prevents the accurate processing of the verbal statement made even though the ear properly hears the sound. The boy jumps the fence. The boy jumps the fence. The boy jumps the fence. Often, someone with CAPD will hear a wide range of different words and/or add in extra letters from what was actually spoken. With such alterations, it changes the entire meaning and understanding of the spoken sentence. If CAPD is not recognized in an individual and addressed, processing delays will undermine the natural development of learning and reading. It is important to keep in mind that individuals with CAPD do not have speech delay and have normal hearing tests, which often results in a delay in diagnosis. CAPD is often considered an ear version of dyslexia, which is a visual processing disorder. As such, educators and healthcare professionals should maintain a high index of suspicion for CAPD whenever there is concern for accurate verbal comprehension in spite of a normal hearing test.
All right. So, we thought that that was kind of interesting to be able to actually watch that video because it explains it really well. Again, we talk about what APD is, but what APD is not is necessarily a hearing loss or what we consider a hearing loss, right? You could have a normal hearing test when you go in to see an audiologist and have the hearing test. It's not a learning disorder necessarily. It can lead to learning disorders, right? But it's not necessarily a learning disorder or a cognition disorder. But as you can tell, it's just the way that things are processed, right, in the brain and how these senses are going. So with that video too, it really talked about, that an estimated 5% of what they were talking about is school age children, right? Which means 2.5 million children may have APD. Now, the prevalence is somewhat sketchy because maybe there's undiagnosed or misdiagnosed cases, right? And so as we continue to talk about this topic today, you'll see how easy it is to have that misdiagnosis. Bless you. Okay. So, but what I also found that was interesting is not only with kids, but also veterans. Veterans, actually, there's an estimated 15% of military veterans that live with auditory processing disorders due to the blast exposure. So these statistics were taken from the Healthy Hearing Foundation. And, they're taking a look at some behavioral issues that the veterans might experience, such as like memory issues, learning issues, communication, and emotional regulation and issues as well. And then when we talk about older adults, which including those that have hearing, because that video said that not necessarily do you have hearing loss, but you could also have hearing loss. But older adults that may have the typical hearing loss or maybe near normal hearing loss, they might exhibit some age-related central auditory processing deficits. And so we're looking at whether or not the based on peripheral, right, hearing, if that has a result on the central auditory system as a result of So that's kind of cool too. And so a part of our practice when we are talking to patients that have a hearing loss and we're talking to them for the first time and going through a consult talking about hearing aids, we actually have a cognition screener in the office. And so we take a baseline reading. It's called CogniView. And we take a baseline reading of where they are cognitively. And we want to see if we are able to work with that peripheral hearing by giving them a hearing loss, does some of their cognitive reserve get preserved? And so, or actually improve too, right? And so it's interesting to take a look at that as well. And it's something that we're excited to have in our office, which is the CogniView system, which is actually right behind Dr. Galloway against our other wall over there.
Yes, it's right there.
So
that white card.
We wheel in to different rooms that we have, but we will do the CogniView as well. So what we talked about so far, if you're just joining, is kind of about the about auditory processing disorders, maybe some different environments, but that you might notice. Most of the time, it's going to be like where it is noisy that you're going to notice this. Funny enough, I don't know if it's necessarily auditory processing, but we talked about where you might also get distracted, right? And you're thinking that if you remove something, then hopefully you can kind of pay attention and focus a little bit. We've talked a little bit more about what APD is, right? And then what we're going to talk a little bit more now is how do people get APD, right? Because it's called a disorder, but again, it's not necessarily something that you get or you catch, right? Like COVID or something like that. But there are some thoughts surrounding this. And so number one, just to give a caveat is sometimes it's just unknown. Sorry to tell you that. I hate when we have to tell people that, but sometimes it's just unknown. People just kind of develop this. What we found out that Dr. Galloway and I did some research is that the auditory process is fully matured by about maybe 13 years. So it's possible that if your child has APD or has been diagnosed with APD, that they can grow out of it by age 13. So the listening system usually develops by around that age, and about anywhere between 12 to 15 years, typically about 13 years of age, you have that complete auditory processing maturity. So that's good to know. The other thing too is that that I wanted to talk about real quickly as a point is that APD is actually recognized as a specific learning disability, even though we had talked about that earlier, under the IDEA, which is the Individuals with Disabilities Education Act. And the only reason why I'm talking about this is because it helps your student qualify for any reasonable services and accommodations at school if they've been diagnosed by an audiologist. And so we do auditory processing disorder evaluations that Dr. Galloway is going to talk about. And so if your child may have a result of a learning disability because of that. And so if you are trying to get all the rounds done and trying to check out your child and you have a hearing test done and the hearing test comes out normal, but you're noticing that maybe they're struggling in the classroom and the classroom has this dynamic classroom where maybe the teacher's walking around, there's lots of noise, it might be worth getting an auditory processing disorder evaluation so that we can kind of check that out. Okay. Another way that we've noticed that people start to have some auditory processing disorders are our brain injury and concussion patients. And so we, again, work with them because we work with the brain injury and concussion specialists, but sometimes these neurological disorders as a result of brain injuries, they become more susceptible to APD because of that damage to the central nervous system. And then you've also got nervous system diseases like multiple sclerosis is another way that people can get it. The other thing that I was going to talk about too is we've also kind of learned that if you had kind of a history of recurring ear infections as a child before you have that fully maturation, right, of your auditory processing at age 13, it's possible that, and especially because a lot of ear infections go undetected, because unless you have a fever or you're tugging at your ear or you're noticing, that you're not hearing as well, and a child doesn't always tell you, but when you're young and you have recurring ear infections, that can also lead to auditory processing because the neurons are firing. It's like it's not developing yet, and you're missing out on some of these sounds and words and the meanings and everything, and that hierarchy that we showed you, right? And so it could be like a delay, but there are different ways that you can improve your processing skills. And so Dr. Galloway is going to talk about that as well. So those are some of the things. Anything else that you wanted to add?
No, I think that auditory processing disorder, actually, I just learned by Googling that it's not in the DSM or the diagnostic manual, which is really surprising to me. And I'm probably going to dig a little bit deeper. Angela Alexander or anybody else who works a lot with APD, if you're listening, I'd be interested to hear about that because I know there is an ICD-10 diagnosis code for auditory processing disorder, but apparently it's not in the DSM. So that's interesting to me. But because if you've worked with somebody that has true auditory processing disorder, it's very different than just hearing loss.
Mm-hmm.
And, you know, all of us have an auditory processing ability that's going to get better through childhood and until, you know, age 13 and kind of continue to get better. So some kids, it's just a matter of maybe they're a little bit behind their peers with their auditory processing ability, but you can be tested for it. Typically, I know you can test younger than age 7 for sure, but there's a smaller group of professionals that are doing testing under age 7 just because the testing materials, some of them are only normed at age 7, including the one that we use that I'll talk about. The school district is a good place to get started because if you feel like your child is having issues at school, you know, they might want to rule things out like ADD. A lot of times ADD, ADHD, there's different things that can kind of appear the same way as APD, like inability to follow multi-step directions, or you know that he understood what I said, but then you know a few minutes later didn't follow through or something like that. And so a lot of times parents will think that there's you know something going on, kids are having a hard time paying attention, when really it's just you know the ability to process that auditory information. So the test that we use to evaluate is called the SCAN, and that is an acronym, SCAN 3. So I've got kind of my score sheet here that I can show. This one is for adults and adolescents. We also have a different version for children. And so what this test is sort of higher level auditory. It's sort of taxing your auditory system for any person. If someone with totally normal hearing, no auditory processing complaints takes this test, they'll say, wow, that was hard, because you really have to pay attention. I worked on a research study in grad school and I tested a ton of kids for APD just to kind of just to see what our results were. So I got really familiar with running these tests. And actually, to get used to doing it, I ran it on my husband at home. And I did not have a sound booth at home, so my setup was not what you would expect, you know, to have an official test. And while he was taking the test, one of our dogs started chewing on a bone, and it was loud, you know, and then he scored borderline disordered for auditory processing disorder. I don't think he would have scored that way in the booth, but that just goes to show that any little conflicting information can draw your attention away from the auditory signal enough to kind of disrupt you. When we run this test, what we're doing is making the auditory signal a little bit harder. So like it'll be filtered. Words will go through, so we call it filtered speech is one of the subtests. It sounds like a bad recording. It sounds a little bit grainy or kind of far away, or maybe you're listening to a recording from like decades back where it's just, you know, not a great recording. That's what it sounds like to me. And so then we'll have people repeat words back through that are filtered. One of the subtests is called competing words directed ear, meaning that there's going to be 2 different words presented, one on the right side, one on the left side, and we're going to ask you specifically to repeat back what was on the right side or the left side. So you have information presented on both sides, and you have to narrow it down to the one you were instructed to. That's harder than you would think because we're not used to doing that. The other thing that we do is called competing sentences. So one sentence will be presented to one ear, another sentence to the other ear at the same time. And you're supposed to be able to repeat back either left or right, depending on which one we told you. So these aren't the sort of tasks that you have to do in your everyday life usually, but they can really show when somebody has a deficit. Some of the other supplementary tests that we don't always do, one's called time compressed sentences. So it's like you just sped it up. If you've ever listened to a podcast and you have the ability to go like 1.5 or 2 times. I did that once on accident and was like, why is this so fast? I can't keep up with this book because I had put it on double speed. So it was time compressing the information. So those are the kinds of subtests. And when we score it up, we can see if a patient scored, within normal limits for their age group on some of the subtests, and they really had, some deficits on some of the other subtests. That can be helpful with treatment because we know where this particular person is struggling. So the way I think about APD is, detecting the sound is very ear level. You press the button if you heard it, and you don't press the button if you didn't hear it. But as the information creeps up the brainstem, there's these more involved processes. And each sort of step up the brainstem before we get to the auditory cortex gives us more information about the stimuli. So we can use that sort of hierarchy to get all the way from detection to comprehension. So the scan test is the one that we use. It's, as far as I know, the only one that you can just do the one test battery and diagnose. But I know our colleague Angela Alexander, she's a big fan of the Buffalo test battery. I did use that in grad school, but I'm not as familiar with it. So there are a few different sort of tests to test for auditory processing disorder, and they allow us to see what areas the person is struggling. So as far as what treatment looks like for auditory processing disorder, there's a lot of kind of different ways that we can go. So the biggest thing is, making sure the child is going to have increased access to this auditory information, whether that be preferential seating in the classroom. There's a lot of environmental things that can be taken into consideration, but there's definitely formal treatments as well. So I've done a lot of research on mild gain hearing aids for auditory processing disorder. That is effective because we're using those advantages of the hearing aids like noise suppression. So I have normal hearing. I put a pair of hearing aids on. If I go into a restaurant, they will help me because it will help to suppress the noise and make the auditory signal that I'm listening to a little bit more obvious. So we're kind of using the features of the hearing aids, not necessarily the amplification part, to help the patient. So it's kind of like environmental factors. You can't go turn the radio down at the restaurant or kind of change some of those acoustics. In the classroom, we could, and we should try to do that for a child if that's going to help them. And usually there's a team approach in the school. So, they may, especially for if there's going to be special services provided through IDEA or a 504 plan, which is another type of plan that provides special services in school. Those are something that there would be an interdisciplinary team meeting to try to figure out, okay, what can we do to help this child, this patient? So there may be, somebody that comes in the classroom and says, hey, we could do this, or we could do this to make the classroom a little bit easier listening situation. Hearing aids are something that we can discuss for the right patient, but of course we'll try to do other measures first. And then there's formal therapy. So using that hierarchy, we call it auditory training. Similar to what would happen if you had a patient who had hearing loss for a long time and got a cochlear implant. We have to sort of refresh their brain on how to process all of that auditory information. So we can do auditory training. Usually there are some audiologists that do it. There are speech pathologists that work on that. And there's an online therapy program now through our friend and colleague, Dr. Angela Alexander, called APD Support. I really like her website and her resources. She has her TED Talk on there too. And I actually had a patient recently who's 16, and she has just been struggling so much. Finally figured out, it's auditory processing disorder. She scored in the less than 0.01 percentile for her age group. And she was the person who, those sentences that she would repeat back would be something completely different than what the sentence was. And I can only imagine how much she struggled and how frustrating that's been in the classroom, especially not having a name for what's going on. They had worked her up for, ADD, ADHD, learning disabilities, dyslexia, tried to look at everything. And auditory processing disorder is ultimately what she's dealing with. And so I referred her to Angela's site, that she watched the TED Talk. She was really encouraged. She did get some mild gain hearing aids, and she's going to sign up for the support online. But it's made such a huge difference in her life just in this short amount of time that we've, assessed her, diagnosed, and then kind of worked forward with treatment. So there are, different options for therapy out there. I love that there's an online option now, and it's actually really affordable. I was surprised. It looks like you do like 6 months at a time. So I did recommend for my patient to kind of check this out online. I also gave her some resources to some local speech pathologists that will work with auditory training and kind of work on the specific deficits that she has. Um, and then there's other things out there that haven't really been verified as much. There's in the 90s, something came about using a filtered earplug for patients with auditory processing disorder. I did some quick research and just tried to look, and I can't find anything that's validating that being helpful. So I don't, I can't speak, ultimately on that. That's not something that we recommend in our office. But I wasn't able to find research that kind of shows exactly how that works or why that works. But it's definitely something that is recommended to some parents. And so I wanted to kind of touch on that because we've had parents come in and say, my child was diagnosed with auditory processing disorder, and now they wear this filtered earplug. So we haven't, really looked into that or recommended for patients, but that is out there as a advertised treatment.
Yeah. And we spent time talking about this and just like trying to pick our brains of how that would work. And so if there is an audiologist there out there that can wants to join in and put it in the comments, about how a filtered earplug works, I'm just trying to figure out how it works. Just with sometimes that filtered earplug is just suggested for one ear, and I'm not sure how that works when your other ear is wide open too. So I'm not really too sure about that. And we talked about sending a kid into a school with a filtered earplug. It's like that filtered speech sometimes, I mean, it's not that bad, but who knows, right? But giving them a little bit of a hearing loss might even make it a little bit worse. So those are some of the reasons why we don't necessarily recommend it from our office. But again, it's not necessarily something that we totally understand the mechanics and how that's working.
Well, and also, the best treatment for a patient is something that's functional for them. And so I'm thinking of a teenager moving into adulthood. That's not very functional, to have something in one ear, like if you have to wear a headset at work or something like that. My patient that's 16 that's now started wearing these mild gain hearing aids, that's a functional solution for her because it's going to help her in every environment she goes in. She can continue to wear 2 hearing aids for potentially the rest of her life. Or she can, work on therapy and maybe she'll outgrow it. She's 16. So maybe it's just that things are a little bit slower to kind of click as far as the auditory processing goes. But we did want to throw that out there about the filtered earplug because we've heard it, especially in this region, it's been recommended to patients. And I'm not able to find any peer-reviewed research on that as a treatment. So the treatments that we've talked about as far as mild gain hearing aids, auditory training therapies, those have been peer-reviewed, and you can see, a improvement in somebody's speech discrimination or, as a result. So that's kind of what we go off of. But it doesn't hurt to be evaluated. And, with students in schools, it does help them to maybe get some extra services. But I think for adults, it's just the more you know. I have a couple books here. These are written by Dr. Terry Bellis. This one is more of a textbook. I wouldn't recommend this if you're not an audiologist because it's just a little bit more dense information. But she also wrote more of a consumer book called When the Brain Can't Hear. Dr. Bellis is a professor at University of South Dakota, I believe, or she used to be. And she actually acquired auditory processing disorder after a head injury from a car accident. So she's sort of the guru on it, and then also has experienced it herself. So I really like this book because it just gives more information. I would recommend this to parents or, an adult that wants to learn more about auditory processing disorder and if that might be something that's affecting them. But we can definitely assess too. And it is hard to pull hearing loss away. When you were talking about older adults, all of the testing that we use to diagnose auditory processing disorder assumes normal hearing. So if I give this test to somebody that doesn't have normal hearing and they score disordered, I don't really know how much of that is their processing ability and how much of that is their hearing loss. So it would make the most sense to treat the hearing loss and then sort of reevaluate. But there can be a lot of different factors. So that was kind of something I wanted to point out. But yeah, Dr. Bellis, I'm sure she has a website, but these 2 books are kind of what I've learned out of. And it's really interesting, especially if a patient has one specific deficit, you can kind of figure out where the disruption is from ear level to auditory cortex level, as far as where they're showing those deficits. So it's definitely kind of a buzz topic in audiology, I guess I would say, because there's more people now that we have identified with auditory processing disorder than ever before. And so we kind of know, how we can help people better.
Yeah. And this, this is definitely a topic that we wanted to talk about because it's almost like it's one of those unseen things. I mean, hearing loss itself is unseen, but it's most frustrating when you're still struggling and you come in for a hearing test, which is the peripheral system again, right? And you walk out saying it's normal. Right. And you're still struggling. And sometimes when I see that and I see when patients come in, then I'll prompt them to, and I'll ask them a few more questions like, hey, what were the environments that you were having a problem in? And it prompts me to say, you know what, I would really recommend if we put you through this evaluation, And so, because of this, we wanted to just make you all aware of it, maybe get some other audiologists to talk about it on our thread here. But just be an advocate for yourself and know that if you're really struggling, to continue to find somebody to get the answers, right? And so, or an audiologist that will help advocate for you too, because there are some things that we can push just a little bit further and asking good history questions that might say, hey, you know what, I've got this idea. Maybe let's try this evaluation, or maybe let's do this, and we can get more answers for you. And so that's really the important thing, is to know that if you are still struggling after hearing test and your hearing test comes out totally normal, it could possibly be something else as well. So take it seriously and don't just say, okay, then I'm just crazy and walk out the door, and I'm just imagining this stuff, because it is true and it's out there.
Well, and I think the other thing to say is, like, my generation, I'm in my early 30s. When I was going through school, this was not something that anyone was testing for or even looking out for. So there are possibly a lot of adults that would have been diagnosed with auditory processing disorder as children had those resources been available. So maybe it's not even a new issue. Maybe this is something I've struggled with my entire life, but I just thought it was part of it, I've seen a lot of young adults, in their 30s, maybe 40s, that's like describing auditory processing disorder to a T, but they have no name for it and no one's ever worked it up because that didn't exist, or those screening materials didn't exist while we were going through school, which is kind of when it would have been identified. So even if you're an adult and you're thinking, oh, I mishear some stuff and I know I had a normal hearing test, but it seems to be a big issue for me, come in, because it's totally possible that that's just something that wasn't on anybody's radar, when you were going through school.
Yeah. Yep. Great point. All right. So we are here again every Thursday, 12:30 p.m. Mountain Standard Time, with new episodes of All Things Odd. If you want us to cover a certain topic or you have a question, send it to us by direct message on our Facebook page or YouTube even, or even LinkedIn. We also post this on Instagram. Subscribe to our YouTube channel so that you can find our videos faster of our episodes. And yeah, we will be back next week with a whole new episode. So thanks guys for joining, and we will see you then.